Okay, now what we want to do is we want to talk about three of the most common areas that we see tendinitis. We have Kirsten here. She's going to be our patient. She's going to help us to demonstrate how this happens. One of the first areas we want to talk about is the shoulder. Now the shoulder is really unique because the shoulder can move in virtually every direction. And so there's a lot of things that you can do repetitively that are going to cause tendinitis. And the tendinitis can happen along the bicep tendon, can happen up on top in what's called the supraspinatus tendon, or in the rotators. We see this in several different athletic events or activities such as swimming. So you take your arm and you're continually and repetitively coming up and over, and that can create stress through the shoulder. Similarly, if you're lifting weights, let's say you're doing a press over your head and you bring that up, that puts a lot of stress in through this area, and that can cause inflammation. Now, for those of you who aren't necessarily doing those types of activities, if you're at work and you've got a box and you're lifting that box up, same exact type of motion. If you do that repetitively and it's putting enough stress on those tissues, then that can cause tendinitis. Now, if we move down to the elbow, one of the most common forms of tendinitis is called lateral epicondylitis, also known as tennis elbow. It's called tennis elbow because tennis players get it quite often. As they're swinging the racket and they're pulling their wrist back, what that does here is that contracts your wrist extensors. All of these muscles attach right onto this bone out here called the lateral epicondyle. When you contract that muscle, it puts a lot of stress on this attachment point. If you do that repetitively, that attachment point becomes inflamed. And so somebody with tennis elbow is going to push on this little spot and it's going to be extremely painful. Again, for those people who aren't playing tennis, if you're at your desk and you're using a mouse, same thing. You bring the wrist back, it contracts these muscles, putting stress right on this point, and it can become painful and inflamed. The third area that is commonly affected by tendinitis, which is the knee. The key components of the knee are going to be the quadricep muscles, your kneecap, and over the kneecap is a tendon called the patellar tendon that attaches right in this area on your shin. Now, what we see is that repetitive movements such as running and jumping, especially if you squats down, that's going to cause the quads to contract, increasing the tension over the patellar tendon onto the insertion point. And that's what's going to cause that stress and inflammation. So if you're an athlete and you're running and you're jumping, you've got to be careful of that. If you're at work and you're in a position where you're seated and you're having to get up and sit down and do that over and over again, you can have that same type of stress being put through the quads, over the patella or the kneecap, into that tendon. Or if you find yourself having to squat a lot at work, let's say you're a child care worker and you're down on their level quite a bit, that can also cause that same type of stress and inflammation.